Pneumonia is an infection that causes the air sacs in your lungs to become inflamed and to fill with fluid. The severity of pneumonia ranges from mild to severe and can become life-threatening if complications arise. Possible complications include a buildup of fluid in the tissue between your lungs and chest wall. This is known as a pleural effusion, and it can make breathing very difficult. Another complication arises if bacteria from your lung infection enters the bloodstream. When this occurs, other organs may be infected, which can result in an organ failure. Furthermore, a lung abscess may form if pus accumulates in a cavity of the lung. Lastly, respiratory failure can occur if you do not have enough oxygen in your blood, which may require the use of a breathing machine in the hospital.
Some general signs and symptoms of pneumonia include fever, chills, a productive cough, shortness of breath, fatigue, and chest pain with breathing or coughing. Our patient Betty Williams is a 71-year-old female recently diagnosed with hospital-acquired pneumonia. While there is a lot of overlap between general symptoms of pneumonia and symptoms of hospital-acquired pneumonia, I want to specifically outline some symptoms of hospital-acquired pneumonia. Hospital-acquired pneumonia develops at least 48 hours after hospital admission and includes symptoms of mental status changes or confusion, a cough with greenish or pus-like phlegm, fever and chills, nausea and vomiting, general discomfort or an ill feeling, loss of appetite, sharp chest pain that worsens with deep breathing or coughing, shortness of breath, and decreased blood pressure and rapid heart rate.
Mrs. Williams should take ciprofloxacin 500 milligrams every 12 hours. Ciprofloxacin, also called Cipro, is an anti-infective used to treat respiratory infections. The Cipro should help resolve the symptoms that Mrs. Williams has due to the pneumonia. Cipro has a rapid onset, which means it should begin working very soon after taking it. Cipro should not be taken with the drug tizanidine and should not be taken if you have a history of myasthenia gravis because it can cause muscle weakness and breathing problems. In addition, take Cipro with a full glass of water and do this at the same time each day. Sometimes it can cause stomach irritation or a stomach ache, so if this occurs, then you can take Cipro with food.
First, I'm going to be doing a general checkup of your lungs, vital signs, and a throat swab to monitor how the infection has changed and make sure that Cipro is the right drug for you. I will also be checking you pretty frequently for the first couple of hours to make sure you're not allergic to this drug, so please don't hesitate to hit the call light if you see any swelling, rash, or difficulty breathing. There's also a chance that this drug will kill off too much of your good bacteria and cause some complications. Those problems look like diarrhea, stomach aches, fever, or even blood in your poop, so if you start feeling any of these symptoms, please alert us immediately so we can take care of it as soon as possible. Some other adverse effects you want to look for is seizures, suicidal thoughts, or nausea.
It is very important for you to attend your follow-up appointments with Dr. Dular and to follow your treatment plan carefully. Please notify your doctor if you start to develop any of the side effects of Cipro, especially if your blood glucose levels become too high or low. Also, remember to take the full dosage of Cipro because it is more likely for your pneumonia to return and for the bacteria to become resistant to future treatments if you do not. It is crucial to rest in order to avoid relapse. You may talk to your doctor about when you can return to your normal routine. Contact your doctor if your pneumonia gets worse or does not get better after 1 week of starting antibiotics.